Well, good evening and welcome to the 7 o'clock talk. And tonight we're going to give a personal testimonial about a product we use with our daughter and how it has worked for her. And I want to preface this by saying that we do all of the functional medicine stuff with her. She has a clean diet, she sleeps 8 hours a night, if not more. She's always outside getting exercise, um, good friends, and so, the foundation are there. But I will let Jessica give you some background, and then we'll talk about what we used and how we used it, and where she started and where she's at now. So,
Well, she's like totally anxious always. She's just high strung. She's just a high strung girl. But I think she just kind of came into the world like that. So she came in with a traumatic birth due to a car accident at 27 weeks gestation. She was in Riley Children's Hospital, I think right at 13 or 14 weeks. She had multiple brain bleeds. So you have three layers to your brain. You have the outer layer, the inner layer, and then you have the middle layer, and that they call it the arachnoid, but it's basically a layer that has holes all in it, and the fluid is supposed to go through that layer. And it because of the blood, it clotted in there, and so it created fibers. So she doesn't have the ability to um, regulate the pressure in her brain. So she has hydrocephaly, and she has a shunt. So that shunt regulates the fluid and shunts the excess fluid into her stomach. So she has always been really anxious. Well, and so for the first 3 years, she was pretty fragile. And so we were always in and out of the hospital. The littlest things set her crazy, like oximeters, like the little red light. Like even now, she gets crazy over a little light on her finger that does not hurt her. But she spent all of her little years with these things attached to her. So I'm just going to think possibly it's just from like traumas. Like it's really emotionally kind of scarred her. And then um, we've taught her to meditate. We've taught her, like, she grounds all the time. She loves to swing. So she has coping skills, but she just spins herself up to worst case scenario. Really has it like she's super sassy, super sweet, but yet she is mean because she's just high strung. Like she always thinks the worst. Like she thinks she's gonna throw up.
hold on a second. We have somebody that is saying, pay attention to me.
Yeah. Libby could use some. Anyway, she sleeps good. She's always had a fabulous diet. Although she was exposed to multiple rounds of antibiotics, multiple surgeries, um, reacts to anesthesia. So poor girl just has had a time for the first 5, 6 years of her life, multiple surgeries.
So let's talk about how that sets things up.
So that messes up her microbiome, and then, well, you can talk more about that.
In the functional medicine realm, she was brought in, and she was a traumatic birth. And since she was a traumatic birth, she was C-section, and then multiple rounds of antibiotics. And so the microbiome, you get seeded with your microbiome by traveling through the birth canal. And when that doesn't happen, the first thing that you get seeded with is the biome of whatever. So with a traumatic birth and out, hands.
Well, when we talk about traumatic birth, she was an APGAR score of 0 at
Better explain
3,
that.
and 5 minutes. So she literally was born black. And an APGAR score is, so it's 0 to 10. 10 is if you come out crying, which babies do come out head delivered crying. So she was a 0. So there was no reflexes, no movement, nothing at 1 minute, 3 minute, and 5 minutes. So it was about 7 minutes before they even got a left foot reflex. So they just kept going, which I'm thankful. But so she truly came in a bad spot.
And so that's where we start to say how you were born matters, because if you're a vaginal birth, if are breastfed, were you given antibiotics, what has happened? So go ahead.
So once you hit on that, she's always had breast milk. Always, she had breast milk until she was 3, so that was good for her. And she had skin on skin contact at 24 hours. So that was good. What?
The dog. I'm just telling Libby no. So skin on skin contact. So, and then eventually you got to bring her home. And when we're talking about traumas, if she threw up, what's the thing with the throwing up?
So brain swelling causes. In a baby, of course, they can't tell you what they're feeling, and they can't tell you what's happening. So if she threw up, then you automatically had to assume that she had brain swelling, which every single time I took her rushed her to Riley, we ended up in a brain surgery. So she had 4 brain surgeries in the first 2 years of her life, and then one scheduled to get a reservoir out. But and she's had multiple hernia repairs. She's had multiple eye surgeries. I'm trying to think. I think that's about it.
So long story short, every time this child had something go wrong, every time anything happened to her, she's in the hospital, she's getting therapies, she's getting surgeries. So there's a great book called The Body Keeps Score, and it talks about trauma and past traumas and how the body remembers that. So let's fast forward.
Before we do that, so she was always, if we went to the hospital, it was always admission into the neuro intensive care. So it was always multiple lines, and she had lines all over. So she didn't have good veins, so they always had to go into her ankles. So there was always multiple sticks and every 15-minute checks. So it was just traumatizing. So she grows up. She's absolutely healthy. She has a mild case of cerebral palsy. We work through that we go to multiple rounds of physical therapy, occupational therapy. But otherwise, I just really push her to live her best life. And she is just super anxious. So.
Well, hold on. She's not. What about her medications?
So when she started out on handfuls of medications, so she had premature retinopathy, which is the retinas detached from the backs of the eyes. So she had eye drops and salves for that. She had premature birth, so her lungs weren't developed, so she has a little bit of asthma. She's completely outgrown it at the moment. She just does an inhaler if she needs it. She had steroids, so because she was such a small baby, and she was born in the cold weather months. She had, I want to say it was called Zypris. Anyway, it was a injectable she had to get once a month for 3 months that basically stimulated her immune system. I'm trying to think what else she did. So because she had cerebral palsy, right-sided weakness, she had bowel motility issues, so they wanted her to take Miralax, which we quickly stopped that because that just caused all kinds of problems. Anyway, due to good diet and exercises for her, and I took her off of medications and did essential oils. We started with essential oils, vitamins. So it takes 0 medications, and we just did supplements. and she's had really no issues.
But for the testimonial, anxiety, anxious. If she gets, if she feels bad, she starts to cry because she thinks she's going to the hospital.
Gets a headache. If she gets nauseous, if she thinks she's going to throw up, if she even thinks if she gets a scratch and she thinks she's going to have to go to the doctor.
If you look at her and you go,
wellness exam.
If you look at her and you go, ugh, oh, she
loses it.
That is a true trigger.
But she also gets chiropractic care and all kinds of therapy. So that's really everything that is done for her now is holistic in nature, except we could not get her, in my opinion, her nervous system needed reset, or we could not get it to turn off. We do meditation with her. We do grounding, and she's known how to breathe since she was 2, because that's how I used to try to get her to calm. So she'll actually sit in a chair and actually breathe for herself. So she's got little tools. It wasn't working.
Defiant.
Yeah.
Would get in a mood. So we knew that there was something going on, and we spoke to our Metagenics representatives.
Well, actually, we were talking on something totally different, but he was explaining a line of products, and as he's talking, he's just speaking to me. Trevor thought he had a patient, but then I was like, no, we need this for Gracie. So
we started Gracie on, how many she take? Just one?
She just takes one.
So she just takes one, and it's Nusera, and it is Serosyn.
And this combination for Gracie was absolutely life-changing in 3 days.
Yes.
Like, life-changing. Totally different girl. We went from everything negative, the world's ugly, you should be afraid of it. I don't know that I've ever heard her giggle since she was tiny. Rarely laughs. She's super serious about everything.
We started with a trial. We bought one bottle of each, and ends up that it worked so well, we just went ahead and bought a year's supply because we aren't going to risk running out of this stuff.
Well, so one of these is a chewable. Uh-huh. She actually takes this on her own every morning by herself because she knows that it makes her feel so good. So this is a tablet. She just chews it. Actually, she says it tastes good. And this is a capsule, which she does have problems with swallowing capsules, but she actually figures it out to get it down for herself. And if she forgets, it is a bad day. Like, if she didn't take them when she first woke up by lunchtime, and we get tears, and she just,
the anxiety comes
back.
Now, these are nutritional products. They are supposed to work on and help the serotonin, the neurotransmitter pathways. And so these are not treatments these are just to help the body. And what we notice is that the anxiety and the doom and gloom and the defiance, the defiance, the thing that irritates me the most is the defiance. And you can be right, and she has to be right. And she will argue till she is blue in the face on, she's not wrong, she can't be wrong. And this has made, so what serotonin does is serotonin helps us relax. So like when you sleep, serotonin puts you into that deep sleep, and it allows you to rest and repair. It helps the parasympathetic pathway. And so that's what this works on, and this helps. And I have been just amazed at how well, because in holistic care, you don't really do pill for an ill, or you don't think about a condition. You think about the things that cause the conditions, and then you start to work on helping those pathways. And these are just things that I never thought it would help. And in the beginning, I was reluctant. I was like,
He was quite skeptical, and I really wanted to try it because the last time we went to a wellness visit, her pediatrician, who is not about, she's not pressuring on vaccines, and she does not like to medicate, and she actually suggested, hey, we might want to try something because this, she cannot relax, she cannot turn it off. And as her parent, I watched her, and it was painful because
you can't help your child.
You couldn't help her because you could not turn off the negative loop. And she gets really good food, so she her weight is great, like she looks great, and she just couldn't feel great because I think she was so conditioned from birth to always be worried about what was going on around her. Even though I wasn't worried, she couldn't turn that off and turn it around for herself. So when Andy was talking about this, I thought if we could turn that off for her or help her basically to retrain her brain to live in a calm world, eventually I think we can get rid of these because she's just a totally different person. She laughs, she giggles, she focuses. She's just a totally different person.
So we want to say thanks. If you are wondering about these products, they're there. I'll put them in the description below. And wanted to do a big shout out to Metagenics because
Absolutely.
These formulas were spot on.
And these are just 2. So I think this actually is a line of products.
Yes.
And I want to say there's 6 or 8 different things. These just happen to be the ones we picked. I actually let Andy pick, and he picked whale. So these are wonderful products.
Make sure you talk to your doctor or functional medicine doctor and or your Metagenics representatives.
And I will say these are not covered by insurance, but these are not prescription drugs. This is not changing the chemistry of the brain. This is only supporting the things that it needs.
The pathways, yes.
So if you have a child, because they are okay for children, again, talk to a rep to get the dosage for your child, your teenager, or an adult. But if you have physicians that would like for your child, your teenager, or your person, you or your person, to be medicated, I think this is a viable option to try first because it does not change the brain chemistry. It does not create issues. This is just supplementing and supporting your serotonin.
Yeah, the Serosyn says on the bottle, support for calm, positive mood. And the other one called Nusera says relief for stressful moments. And so highly recommend. I'll put the description down below. Full disclosure, we do sell these. But like I said, we bought a year's supply for our stressed out, anxious, doom and gloom, defiant, beautiful little daughter. She's wonderful, and it has worked so very well. And so thank you, and we will put everything in the description below. You have a wonderful night.